The proposal presented to Parliament last week that patients will soon have to pay for treatment at the renovated Mulago Hospital has attracted debate among Ugandans, and the Speaker of Parliament, Rebecca Kadaga, has voiced her opinion. Speaking at the launch of the mosquito net project in Kamuli district on Saturday, Kadaga criticized the idea of having Ugandans pay for these services.
The 90% should have the medicine free, and then the 10% should they want to pay, if they really want people to pay. But to ask ordinary people to pay money in a government hospital, no.
What government is doing is the right thing. Whoever is opposing it is a person who wants to bury their head in the sand, what we define as insanity. Insanity is doing the things you do in the same way every day, and you think you're making progress. No, we have to think outside the box so that the population of Uganda can benefit.
But the Minister for Health, Dr. Jane Aceng, explains that the government cannot afford to offer free specialized services at the hospital.
Even when we refer patients abroad, we refer them and we pay. For those that we don't refer, who have their own money and go, they also go and they pay. If I talk about kidney transplant, the cost, just one person, the cost cannot go below $7,000 to $10,000. One person. Look at the budget that you have. Even now, people who go there to do dialysis, the dialysis cost alone, if we were to give free service to all the kidney dialysis patients, all the budget that goes to buy essential medicines will go to buy dialysis.
Aceng has asked for support for the venture, which she says will reduce the cost of treatment abroad.
At least you pay here and you don't pay the costs of flying, because the costs of flying abroad are also enormous. If you have the services here, that is reduced for you, and it is subsidized for you by government. As you're all aware, the attrition rate of our doctors has been high because the pay is inadequate. If we are to maintain specialists, we need them to be paid better. We need them to be motivated so that they can do that work. And Mulago can only do it if we all cost share.
Government borrowed $49 million, which is about 130 billion shillings from the African Development Bank to renovate and equip Mulago to become a first-class facility. Dr. Aceng says government will maintain the national referral facility at Old Mulago.
We shall have Mulago specialized, and we shall have Mulago referral. Now, Mulago national referral will be the upper Mulago, or what you know as Old Mulago. We are not going to close that. We shall leave it for free access to patients, but also for specialized services when they have been referred.
The new unit in Old Mulago is slated for opening in October this year. The hospital hopes to raise 191 million shillings annually to go towards, among other things, staff allowances and salaries. Agness Nandutu, NTV Tonight.